Hey everyone, this is Muhammad Bilal, physiotherapist from Somalia. Today we are going to discuss about one of the electrotherapeutic techniques which we used in our clinical setups, named as a Russian current. The topic is Russian current. So the Russian current is a kind of a medium frequency current. This was discovered and developed by Yokova Notes in 1977, a Russian scientist. Initially, he applied this therapy or the current for the athletes and Olympic players who is participate in the Soviet Republic Olympic pair. Later, this concept has been applied for a other clinical condition, which we discussed in the upcoming slide. Okay, so the Russian current is a medium frequency current. This current was discovered and developed by Yokova Notes in 1977. Initially, this Russian current has been applied for athletes and Olympic players who is participated in the Soviet Republic Olympic patterns, and later this has been applied for other clinical condition. So there are three types of a current: low frequency, medium frequency, and high frequency. Low frequency from 0 to 100 Hz. Medium frequency, those current which fall under 1000 to 10,000 Hz is come under the medium frequency, and high frequency is above 10,000 Hz. What are all the modalities which come under the low frequency is, in our clinical setup, TENS and stimulators. What are all come under the medium frequency is the electrotherapeutic modalities which come under the medium frequency is interferential therapy and Russian current. The high frequency above 10,000 Hz is shock wave diathermy. So these are all the different wavelength of current frequency and under which the therapy which we are going using. So current topic is on the Russian current. In another video, we see a detailed clinical parameters of a IFT and other things. So today the topic is on the Russian current. So the Russian current, it's a medium frequency current with a basic carrier frequency range of 2500 Hz. Medium frequency sinusoidal current, which means it has both a sine wave and a cos wave, sine wave and cos wave, applied in a interburst interval time with a burst module. There is a rest time or the burst of time, again followed by the burst on time, which is again a sinusoidal waveform has been started. So medium frequency current with the sinusoidal waveform. It has a basic carrier frequency of start from the 2500 Hz, basic burst frequency of 50 Hz. Normally all the modalities in a recent modalities we buy or we purchase will have a burst frequency range from 0 to 100 Hz. Okay, this range will vary based on the clinical condition we are get. Like for some patient we choose 35 Hz, for some patient we choose 50 Hz, for some patient we choose 75 Hz of burst frequency. Okay, so this is the basic burst frequency range, and basic carrier frequency start from the 2500 Hz and basic burst frequency start from the 50 Hz. So when we apply the current to the patient, as we already discussed, this medium frequency current for Russian type applied with the interburst interval or with the burst of time, or we should apply in a burst mode. Burst mode means it is applied for a period of a second followed by the interburst interval, again for a burst on time for a period of interval. So this is the burst on time, burst of time, and again on time for a burst. So the current amplitude or the burst frequency, or either we choose a 35 or 50 or 75, is applied in this time period only. So in this time period, this burst frequency has been applied at a pulse rate of 25 pulse per second, followed by a period of rest time, again followed by a period of burst on time. This on and off time for a burst mode may be differ from the various clinical condition, but the basic treatment regime initially that Mr. Yokova notes applied to the patient is 10, 50, 10, which means 10 seconds for burst on, 50 seconds of burst off for 10 minutes every day for a period of 3 to 4 months to get the clinical outcome which we require. So again we go through. It's a medium frequency sinusoidal current or the alternating current, not the direct current. Direct current have a waveform of only like this. So this is the sinusoidal current, will have a waveform of both the sine wave cos wave, again sine wave. Okay, so it's a medium frequency current, so it's fall under 1000 to 10,000 hertz. So it has a basic carrier frequency range of 2500 hertz, the basic burst frequency of 50 hertz, and all the equipment modalities will have a burst frequency range between 0 to 100 hertz. So depends on the clinical condition, we may choose between this range, either 35, 50 or 75. So it has applied in a form of burst mode. Burst mode is nothing but it has both the on period, off period, again the on period. And since it's a medium frequency current, it has the depth of penetration, deeper depth of penetration, and comfortable for the patient. The depth of penetration for the current is much deeper compared to other form of a current. So it recruited more number of motor fibers so that we can achieve the muscle strength very easily. It mostly target the motor nerves, not the sensory nerves. In the sensory nerves, the current is target very little. So its depth of penetration is much deeper and it is very comfortable for the patient even if we go up to 100 hertz of burst frequency. But for a better clinical outcome, 50 to 75 hertz is fair enough to achieve the clinical outcome. So here comes the characteristic slide of the Russian current with a carrier frequency range of 2500 hertz, burst frequency range of basic for 50 hertz, maximum up to 75 hertz. Okay, with a burst on time for a burst on and burst off time may be differ. It may be differ from the various clinical condition. Start from a 10-second on to 50-second off, or 10-second on to 10-second off, or 10 to 12-second on to 15-second off. Mostly for a muscle re-education or to get strength of the muscle strengthening. This burst on and burst off time will be comfortable. For edema reduction, in case of any ankle sprain or general edema, we can take this burst on and burst off time for promoting the pumping action of the muscle. In case of a muscle spasm, we can select this burst on and burst off time, which is comfortable for the patient. And it has another characteristics of a ramp. In the modern equipments, the ramp setup is not available, but before 20 years to 25 years before, the equipments have a setup name called as a ramp. So it is nothing but setting a ramp is a ramp on and ramp off time. It's nothing but to achieve a voluntary like a muscle contraction, we have to increase the intensity slowly, and again the intensity has to be decreased slowly, followed by the interburst interval. Again we have to increase the intensity slowly and followed by the gradual decrease in the intensity. This is the ramp up and a plateau followed by the ramp down. Ramp up and a plateau graph followed by the ramp down. So this is looks like this kind of a setup gives a voluntary like a muscle contraction. How a person who's do on his own is look like we can achieve this kind of a muscle contraction when we set up a ramp on and ramp off time. The ramp on time will be mostly for 1 to 2 seconds, and the same will be the ramp off time will be 1 to 2 or 3 seconds. So this is called as a setting ramp, which is mostly not available in the recent modalities, modern modalities, as it is pre-modulated inside the equipment itself. Based on the research from the company, they just pre-modulate it, and the outcome we get as a ramp on and ramp off time. So these are all the basic characteristics of a Russian current. And the electrode placement should be always parallel to the muscle fiber. So in case for mostly for the quadriceps muscle, when we apply for the quadriceps muscle, we should apply it in a parallel together so that the depth of penetration will be much deeper and we can achieve the muscle re-education or muscle strengthening of the quadriceps, or for the biceps where we have to apply for the shoulder condition in a parallel to the muscle fiber, so we can achieve the muscle power for the biceps or re-education purposes, etc. So the next topic is, this is the kind of oldest setup in equipments. We can find out in the old equipments this kind of a setup will be present. As we discussed, it's a medium frequency current with a range between 1000 to 100 hertz, and this is why we have used this therapeutically, means it has a greater advantage of a greater depth for penetration, and it is highly tolerable and comfortable to the patient compared to the low frequency current. And what are all the physiological effects? To strengthen the weak muscles through recruiting the motor units of the muscles synchronizingly. In case of a voluntary muscle contraction, the synchronization is happened asynchronizingly. It's not synchronizingly happen, it's happened like a asynchronizing method. So in Russian current, when we apply it, this has been achieved through voluntary muscle contraction, voluntary kind of a muscle contraction in a synchronized manner by initially stimulating the fast twitch muscle fibers followed by the slow twitch type 1 muscle fiber. So in a normal voluntary muscle contraction and Russian current induced voluntary muscle contraction. So normal voluntary muscle contraction, the recruiting of muscle fiber will be asynchronizing. And in case of Russian current induced voluntary muscle contraction, the motor unit recruitment should be synchronizing. What is asynchronizing? In case of voluntary muscle contraction, the type 1 slow fibers recruited first, followed by the type 2 fast fibers. In case of a Russian current induced voluntary muscle contraction, it's happened in a synchronized manner. So initially the Russian current recruited the type 2 fast twitch muscle fibers, followed by the type 1 slow twitch muscle fibers. This is what the asynchronization happen in a voluntary muscle contraction, and synchronized manner it will be happen in a Russian current induced muscle contraction. So when a Russian current has been applied to a particular muscle, at a sensory level, it causes a pricking sensation, hence helpful for a pain gate. Through pain control. In a motor level, it recruited more number of motor nerve fibers, hence causes the depolarization of muscle. And followed by the muscle contraction. So all this happen during the burst on time, followed by the repolarization during the burst of time. So hope you can understand. We can go to the next slide. So this form of muscle recruitment, motor nerve recruitment, will cause us more number of muscle fibers to get recruited. So when a Russian current applied to a particular muscle, which causes the recruitment of a more number of motor fibers. Hence, we can achieve the number of fibers in a muscle from a very weak to we achieve the more number of motor recruitments. So this is what the physiological effect of the Russian current. What are all the therapeutic effect? So based on the more recruitment, more motor nerve fibers depolarization may causes the more number of motor fibers recruitment. It will increase the muscle strength, and it will helpful for in case of athletes or for any kind of atrophy patients, muscle atrophic patient, and for muscle re-education. Example, stroke and hemiplegia, for infantile hemiplegia, for children's, for muscle spasm, as the Russian current will causes the tetanic muscle contraction or a normal muscle contraction, will causes increased blood supply to the particular muscle where we are going apply. So it will elevate the pain and reduce the muscle tension by increase in the blood supply. So we can use it for a muscle strengthening, muscle re-education purpose, muscle spasm, and for a edema reduction. So these are all the therapeutic effect for the Russian current. These are all the protocol which we mostly used for clinically for the conditions. So to achieve a strengthening, we should have a carrier frequency of 2500 Hertz. This is basic for all the condition. We could not change as this is a basic carrier frequency range with a burst frequency of 75 Hertz. In our clinical setup, we usually use 75 Hertz of burst frequency range with a burst on time for a period of 10 to 15 seconds and burst of time for a period of 20 to 30 seconds to achieve the muscle strengthening. Hence, the required motor fibers has been recruited in the protocol for a period of 10 to 15 minutes, minimally for a 3 to 4 months. So clinical indication will be post knee surgery patient like knee replacement, ACL reconstruction surgery, or the meniscal surgery, or in case of any neuropathic condition, we in our clinical setup we use this Russian current to regain the muscle strength and to regain the muscle motor fibers, the recruitment of motor fibers. So we use this clinical condition, we use this protocol for the patient. In case of a muscle spasm, we use the basic carrier frequency of 2500 Hz and the basic burst frequency range from anything between the 50 to 75 Hz. We use with a burst on time for 10 to 15 seconds and burst off time for a 10 to 15 seconds in our clinical setup. In my clinical setup in Somalia, we use this kind of a protocol for a period of 10 to 15 minutes for the time period of 7 to 10 days. So as we discussed earlier, for a clinical condition of muscle spasm, as Russian current causes a muscle pumping action. So this muscle pumping action may increases the blood supply to the particular muscle. This will cause to circulate the pain substance into the circulation. So this will reduce or elevate the pain. So reduce the muscle tension. Hence reduce the muscle spasm. For other clinical condition like re-education, muscle re-education, we use the protocol for same like a basic frequency of 50 to 75 Hz with a burst on time for a 10 to 15 seconds, with a burst of time for 10 to 15 seconds for a period of 10 to 15 minutes. Still the muscle is re-educated, mostly for a stroke condition. Here in our clinical setup, we use this protocol So in a clinical condition, in our clinics, we use this protocol which I mentioned above for a muscle re-education purposes. In our clinical setup, most of the patient like hemiplegia, stroke condition, they come to our clinical setup mostly in a wheelchair dependent. Post applying the exercise therapy plus the Russian current, there will be a yearly recovery of gait or the walking pattern we see in our clinical setup for most of the patient in this protocol. This will be most helpful for the stroke patient where we applied. In Somalia, most of the patient has approaches the physiotherapy in a very chronic stage. Even for those patients, when we apply this protocol, it will be much helpful to get their recovery very soon. But for the kind of hand in related to the hand, for the hemiplegic hand, for some patient it will become very early. For some patient it will still take some time for the hand re-education. So for muscle re-education for a stroke condition or hemiplegic, even for infantile hemiplegia, we can use these approaches or this kind of a protocol with a burst frequency range on time, off time for 10 to 15 minutes every day until they get recovered, or to maintain the muscle mass. We can use the Russian current. Okay. Sorry, another one condition we are going to discuss is edema. For the edema, with the same carrier frequency range of 2500 Hertz. In this, the burst frequency range will be 35 Hertz is fair enough, which we can apply during the burst on time for with a burst on for 10 seconds and burst off for 10 seconds. So this will help for the pumping action of the muscle. Hence, this will help to reduce the edema. So this is the burst on time with the interburst interval. Again, the burst on time for in this period we can apply for a 35 Hertz of again the burst frequency has been applied. The current amplitude in all the four condition, the current amplitude or the current intensity or the amplitude will be ranging from minimum of 50 milliamp to 75 milliamp. This is the current amplitude, which means the intensity we are increasing after we set up these things for all the condition. This is the tolerable current intensity. This range is a tolerable current intensity for all the condition we are discussed about. Another one condition we are going to use is trigger point. It's nothing but a hyper irritable taut bands in the muscle fibers. So in trigger point also we are using in our clinical setup for the patient who come with the chronic pain syndrome or the chronic myofascial pain syndrome, where we place the electrode directly over the trigger point to improve the muscle pumping action and to break down the trigger points with a carrier frequency of same 2500 Hz with a burst frequency range of 75 Hz is comfortable, and we get the proper clinical outcome for the patient with the myofascial pain syndrome due to the trigger points which we were palpated. So with the burst frequency range of 75 Hz, the burst on time like this is comfortable, 10 seconds on and 10 seconds off, so it will help for the muscle pumping action, and so it will break the muscle tension by increasing the blood supply. The current intensity or the current amplitude will be same as 50 milliamp to 75 milliamp is comfortable for the patient. So these are all the protocol we used for the conditions. So this is the indication as we discussed earlier. So the indications are post knee surgery condition like arthroscopic or replacement or reconstructive. In case of muscle spasm, muscle atrophy, and POP casting. In case of any fracture where POP has been applied for the patient, in case of POP has been applied for the patient for any kind of a fracture, if the surgeon has sent us in an initial stage itself, we can avoid the muscle atrophy which is distal to the POP and proximal to the POP and distal to the POP for a deltoid, or in case of any knee fracture condition where they put the POP for any kind of a knee fracture patient. We can apply this Russian current to maintain the muscle mass of the muscle which is proximal and very distal to the POP, until unless it will not provide a stronger contraction or it will not disturb the fracture site. So that until the POP has been removed, we can apply the Russian current for the muscle to maintain the muscle fiber, or to prevent the atrophy. We can use it for the casting patient, POP casting patient. And as usual, we see for strengthening the muscular system for the athletic person. What are all the contraindications? Contraindications were, as we discussed, this Russian current will help for the pumping action of the muscle. So in case of any thrombus formation in the blood vessels, or in case of any neoplastic tumors, and in case of any peripheral vascular disorder where the sensation is very less. Hence, for the decreased sensory patient, if we apply the Russian current, will leads to electrical burns. So we mostly avoid for a peripheral vascular condition patient where the sensory issue is present for the patient. And in case of any pregnancy patient and over or near to the metallic implants, like metal implants or cardiac pacemakers, or a DBS patient, like deep brain stimulation patient, we should need to avoid applying the Russian current as it has a depth of penetration is very deeper. In case of a thrombus formation, this thrombus will become embolus due to the pumping action of the muscle. So it will causes, if the thrombus getting dislodged and it will enter into the circulation, will causes embolism, and it will may go and affect the lungs, heart, or even the brain, which causes the related clinical conditions. So these are all the additional contraindication for the patient. And over the cervical, anterior cervical region of the patient, over the anterior cervical region of the patient, as it may interrupt with the carotid sinus. This will causes a ANS dysfunction, or it will increases the blood pressure and other ANS related, autonomic nervous system related disorders, dysfunctions it may causes. So these are all the contraindications. Here, as we discussed, the Russian current has been applied only for a, initially it has been applied for a weak muscles or the athletic person. Why? There is a cause for the weakness in a post-surgical patient, any joint, over regardless of any joint, in case of a knee joint or shoulder joint. Why there is a weakness? It's called as a arthrogenic muscle inhibition. Post-surgically, the muscle around the injured joint or the any kind, not only the post-surgical, in case of any kind of injured joint, the muscles around that injured area will stop or inhibit the muscle activity. This will cause the muscle atrophy. What is the arthrogenic muscle inhibition means? Post-injury or surgery, the muscle around the area will cause inhibition of the muscle activity. This may cause muscle atrophy. So, to avoid this muscle atrophy, we have to start this Russian current therapy to avoid this muscle atrophy in a very early stage of our rehabilitation. How delay we start the muscle rehabilitation, the recovery will takes too much of time to get the recruited number of muscle fibers. So this is called as a arthrogenic muscle inhibition technique. It's a neural phenomena where the body restrict the muscle activation around the injured joint to protect it from the further damage. So it's a kind of a protective mechanism which may lead to temporary deconditioning. Deconditioning means the muscle is not become active or like lazy. So this will causes the muscle to get atrophied and weakness. So what happen in case of a weakness? This will cause impaired of knee extension or the particular area where the muscle is involved. In case of a shoulder or elbow, where the elbow extension has been lost or impaired. In case of a knee, mostly we see around the knee patients or the post-surgical patients for the knee only, mostly we approaches in our clinical setup. So I take this as an example. So the quadriceps weakness following a knee surgery or post-knee surgical condition, there will be an impaired knee extension, which is very common because here in our clinical setup, we always get the patient 2 weeks to 3 weeks post-surgically, as the surgeon will delay the rehabilitation. This will cause us the early quadriceps weakness, especially the VMO, vastus medialis obliquus muscles of quadriceps. So it causes the knee extension to get impaired. Because of knee extension impairment, there will be a less stability for the knee on a dynamic and static gait movement, and there is an increased risk for the early OA. Why? Because as they delay the rehabilitation post surgery or post injury, this will cause us the post traumatic stiffness for the knee. So we as a physiotherapist, we have to mobilize the knee to improve the range with the wax therapy and other modalities. So we have to give some pressure maximally to avoid without discomfort the joint. Anyhow, this will cause us the risk for the early OA degeneration problem, osteoarthritis, and this will also impede the progression in our treatment. So we have to address the underlying causes. So we have to approach, if in case of a hospital setup, we immediately need to approach the patient who has underwent the surgery, and we start our clinical protocol immediately to preserve the muscle wasting. So these are all the places where the Russian current is much helpful And we, in our clinical setup, in our hospital setup in Somalia, we apply this therapy for many patients mostly, and we gain the best clinical outcome, and post-surgical stiffness also has been improved along with the other techniques we used in a physiotherapy, with the wax with mobilization, and even we use the interferential therapy over the particular muscles where it gets stiff. So in another video we will see about the another form of a medium frequency current named as a IFT, and its therapy protocol. We will discuss about it and what are all the which protocol is suitable for a which patient. We will discuss regarding that. Okay, thank you for everyone watching this video. Take care.